Are you getting ready to get into clinic and start your D3 year and you're not sure how it's going to be? Stay tuned as we talk to two students who just finished the D3 year, and they're going to give you all the tips and everything that they did to survive D3 in dental school. Stay tuned. Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist podcast show, where we talk about getting into dental school, surviving dental school, getting into residency, and then life as a new dentist. Be sure that you subscribe down below at my YouTube page, Dr. Darwin Speaks. And then also be sure to hit that notifications button so that you are able to be notified when new videos come out every week. Today, we're going to be talking about dental school and getting past the first year, the second year, and now focusing on the D3 year, which is probably one of the years that most students really like. We're joined with my buddies, future DDS. You guys want to introduce yourself?
Hey, what's going on, y'all? Tyrell, Fridie, third-year dental student at Tufts Dental School.
And Tyler Brown. I guess we're D4s now.
Oh, yeah, well, D4s now, yeah.
At Tufts, University School of Dentistry, yep.
That's cool. That's cool. Well, look, guys, let's jump into it because a lot of people are looking forward to finishing up the second year of dental school and going right into clinic. I know that's one of the big things a lot of people like. So first, let's talk about what you heard about the D3 year before you started. What are some of the things that you heard?
I definitely heard a lot of people say the stress is different. Like you know, you're still stressed, but the stress is a lot different. Like a lot of people say that, you know, I guess the virtue of the schedule and, you know, the day-to-day operation versus, you know, class versus clinic. But I think that was one of the biggest things.
Yeah, another thing was a lot of people told us we had been told a lie, you know. I think that initially we expect to just kind of be done with classes during our third year. Yeah. But we still had classes while we were in clinic. Of course, the class load was a lot lesser than, you know, the first 2 years, but we still had to take classes, but it was definitely more clinical based.
More clinical based. Okay. Yeah. All right. So you guys were able to dispel those myths because you still had classes, right?
Oh, yeah. Oh, yeah. Some tough classes too.
Yeah, it was no joke. It was no joke. I think dental school was more fun because we were able to be actually interacting with patients, but it was still, you know, it was still a lot of didactic classes and a lot of tests. There's still a lot of tests, so don't let anybody fool you.
Right. All right. So, what about the things that you liked the most about D3 year?
So getting back to, you know, us being able to be in clinic, just kind of finding out our groove as actual, like, practicing clinicians within the school. You know, it was great seeing what worked for us, you know, what we thought would work, what didn't work, being able to really, really dive in and get that base layer of who we will be as clinicians. That was great. That was great.
Yeah. I think I like you know, definitely the patient aspect. You really, like, learn what you learn. You learn what you know and what you really don't know once you're in clinic. And, like, I guess you got a little bit more pressure on you. You know, you got a little bit of pressure on you to perform in front of your patient. And, you know, it might be your first time doing a procedure, but you really know what you feel comfortable with and know, at least theory-based, like, theoretically, you know exactly what to do. And now you know what you need to put on action or what you need to study more. So, you know, like Kyle said, just coming into your own as a clinician and as, like, you know, how you interact with people and you know, kind of grow as a provider, not just a hand skill expert or, you know, bookworm. So
Cool. All right. So now the challenges. Let's talk a little bit about the challenges. And, you know, Tufts is the second largest dental school. We're about close to 200. You guys have about 200 classes?
Yeah, with our IS class, we have about 240, 250. Yeah. Yeah.
Okay.
So,
yeah.
200
and all of those students were also in clinic, right?
100%.
Yeah.
So almost 250 students. So let's talk a little bit about some challenges with D3 year that you guys experienced and some of the things that you did to kind of circumvent.
So I say one thing is just like getting adjusted to clinic and that like the day-to-day of clinic. So, you know, a lot of people or a lot of us haven't worked in dental offices before. We haven't really like, you know, some people haven't worked in customer service where they're used to calling people every day or scheduling people or making sure, you know, even using the Axiom system. So there's like a lot of little nuances about kind of being your own practice owner that we're learning. And a lot of people didn't really have that in their mind that they'll have to like go through. You know, it's like, oh, I'm coming to school, I learn how to drill, learn how to fill. I'm gonna go to school, see my patient, and go home. Right. But like, you really have to like call your patients, make sure they're coming in. Patient might cancel. What are you gonna do during your spare time? Like, is there competency I could do right now? There's so many little extra things that stack on top of just doing a class 2 prep, or stack on top of just doing a crown prep or a prep attempt or a root canal or something like that. So
yeah, no, and trying to like build off what Tyrell said. We always say like you have to get surgical, right? And so what we mean by this surgical is like, you know, don't let you do other things outside of dental school as well. You know, don't let you have a relationship. Don't let you have a little side project that you have to do. Really, really breaking down everything that you have to do, and like don't let you have other side project that you have going on. Don't let you have a relationship that you have to, you know, pour a lot of, not even a lot of attention, even a little bit of attention still is going to take a lot from you because you're so busy with doing everything else. And like Tyrell said, you know, the actual part about being in clinic, that has so many different layers where it's so, okay, I'm going to go in and I'm going to work on this denture. I have to review, you know, the denture procedure before I go in. So that's an extra hour added onto my day that I have to, you know, make sure that I'm familiar with what's going on and things of that nature. So really just being surgical, making sure that you have all your competencies completed and you're getting all of that exposure, just becoming the best clinician that you can be. I think that, you know, getting into that groove and understanding that you can't get out of that groove. You know, if you want to relax, you almost have to schedule your time to relax. You know, it's to that point, especially if you want to be super, super efficient within clinic. So it wasn't hard, but it was definitely something that, you know, we had to get a little bit more used to, for sure.
Now, what about, talk a little bit about the fact that, you know, you guys at Tufts are second largest dental school as far as, you know, number of students per class, and how that played into some of the challenges that you might have had.
And so, you know, let's be honest, you know, not everybody, like I said, is as surgical. So it wasn't a problem, you know, with Tyrell and I mean, you know, I think that we looked so far in the future that we were just like, okay, we're booking everything. Like, I have a patient who can come in 3 weeks from now. I'm booking that right now. And I'm calling patients constantly. So we stayed on top of it. And if you're able to stay on top of it, you know, it won't be a problem, you know? And I think a lot of people, when they look at Tufts, they're like, oh, will I get the attention that I need? Will I get XXX? And I will be honest, you know, it's during the actual 3 hour period that you have your patient, you know, of course the PC is running around, but you know, if you go to your PC before the session or after the session, they're always willing to help you and really put in that effort to show you what you need to do and kind of coach you through things. So as long as you're, you know, organized, it actually wasn't that much of a problem.
Yeah, I think, you know, just to piggyback off that a little bit, I think just being prepared. So if you go in there and you look competent, you know, like you look like you prepared, you go in there, you talk to a professor that you want to work with before the session starts, and like little things like that, instead of trying to find someone mid-session, you know, you don't necessarily know exactly what everyone else has on them. It might be on the board, but like somebody might cancel. So anything can happen where, okay, this is a very complex case. The professor actually has to sit with them because this is something that, you know, pretty much nobody in the clinic can do but the professor. And they're just trying to walk people through. So you might not have as much leeway every day, but like Tyler said, if you put it in their head beforehand, that like you're someone that they need to keep in mind throughout this session. Oh, you're someone this might be your first time doing this procedure. Oh, you might just not be comfortable with this type of procedure, or we're short on staff or something like that. Like you put it in their mind so that they can prepare as well. You know, they're a person just like us. So you can't get mad when, you know, they get locked in trying to really help someone, or they get locked into some personal thing they have going on, or letter rec they have to write their PC. Like there's a lot going on. So
all right, that sounds good. And actually, it's a great segue to the last question, which deals with some of the things you guys touched about, which was advice. Knowing what you know now and what you've gone through these last 300 and 66, 67, 68 days. What advice would you have for those that are coming in, entering the D3 year?
Use advice for D3 year. I would say, that's a good one. I really say, like, enjoy the freedom, but don't get lost in the freedom one. Just because, like, you don't have to be in class, you don't have to be in class, you don't have to be in clinic as much. Little things like that. But you do get a little bit more freedom to start enjoying your time. Mm-hmm. So I think it's beneficial to start, like, developing the lifestyle that you want to see yourself having after school, because you can start doing it now without having a lot of the extra things, or it's not costing you money to do a lot of the things, or it's not costing you time out of the clinic to do a lot of the things. Like, start building that structure, start going to the gym early, start, like, picking up that hobby after clinic now, because you might not want to pick up the hobby when you're after clinic. God forbid, you know, if you have a kid now, obviously it's a little different, but, you know, when you have kids, it's something extra. When you have, you know, another side business, it's something extra, you know. So when you have a little bit of money to actually go out and spend, it's going to be something extra. So, you know, just kind of get those habits locked in now. And just learn as much as you can before you hit the clinic, because it's going to make your process in clinic that much smoother and that much easier.
Good. What about you, Tyler?
I would say, I think that everybody should grab some type of notebook. I think everybody should grab, you know, even an app called Day One, and really kind of, like, as crazy as, like, journal your way through your experience. I think that you should really use your third year to find out what type of clinician that you think you want to be. Get some type of idea, because even now, what Tyrell and I are going through, you know, now we're considering residencies. And granted, due to the COVID situation, there's a lot of different variables that we're not able to control. But, like, initially, we were both set on becoming, you know, going straight out and just going straight to work. Like, that was our idea. But now, because of COVID, we have some things changed up. That's always going to happen. But we were confident in the fact that, you know what, we think that after dealing with patients that we're confident enough to eventually be practice owners one day. So we started taking business classes and doing little things like that. And I think that sometimes, and of course, don't live in the future too much, but when you have some type of idea of where you want to be in the future, it makes your navigation through the current situation a lot easier and a lot more fulfilling, because you know, okay, I'm doing this because I want to be here. I'm doing this because I want to be here. When you're kind of just traveling aimlessly without any real goals or any, like, real vision, it gets a little, I don't want to say you'll work less hard, but I think that you're more motivated when you know where you want to go. So just keep that in mind. Journal. And I think that, you know, in a couple of years, when we look back on everything that we went through, when we were talking to ourselves in these journals, whatever it may be, really self-reflecting, I think it will be kind of enjoyable to see where we were versus where we'll be in the future. So
yeah, man, that sounds great. Well, I'm glad to hear that you guys are considering residencies for this upcoming after this D4 year.
Yes.
For the class of 2021. That'll be great.
Yeah.
And you guys that are listening and watching, we're going to have a separate episode about residency. So make sure you stay tuned and check out that video as well. Well, future DDS, or in your case, DMDs, you guys are getting close, man.
Getting close.
Yeah, knocking on that door hard. It's hard now. So D4 year is coming up. And any other plans for D4 year, or things that you guys are kind of thinking about doing? I know you mentioned residency, but anything as it relates to this year as you preparing to graduate?
Really just experience, really grabbing as much as we can. You know, I think that, you know, I'm sure students who are in dental school watching this right now, I'm sure your school is providing you with free CEs. You know, watch those videos, you know, really just embed yourself into the world of dentistry. And that's what we're trying to do, especially in these trying times. It's very easy to get sucked into a lot of other things, such as video games or whatever it may be. But I think we're really just going to try to get as many reps as possible. And the reps that we can't get in the clinic, we're going to get outside of the clinic via different videos, different podcasts, and really just starting to plan out, you know, our future.
Good, good. Well, those of you who are watching and are listening as well, make sure you plan out your success.
Exactly.
Success is not something that just happens. It's something that has to be created. And it sounds like you guys are still on that path and doing well and creating it. So, future DDS, thank you so much for sharing your experience about surviving the D3 year. And you guys that are watching, if you have questions, be sure to post them down here at the end of the video. Also, you guys can shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. Also, check out this new website that we just put up. And you got some things there that you can check out. Future DDS, we'll see you in the D4 year. Thanks, guys.
All right, man.
Thank you, Dr. Darwin.
You're welcome. Peace.